Hi, welcome back, guys. This is part two, chapter two of Mental Health Through Will Training by Abraham Lowe. This is called Will, Beliefs, and Muscles. The Saturday panel discussed the subject of real sensations and fantastic interpretations. Phil, as one of the discussants, mentioned how in previous days, when he was not yet sold on recovery, his pressures, dizzy spells, and confusions made him neglect his work till finally hospitalization was the only way out of trouble. These symptoms, he said, have not disappeared altogether. They still bother me every once in a while. But now, when I have them, I remember what Dr. Lowe has told us frequently. You can throw off any nervous system at any time for a few seconds or minutes if you spot them as distressing but not dangerous. The symptom will come back in the next minute or so, but you can get rid of it again for a short while, and then again and again, and before long you will be rid of the trouble for hours and for days. The symptom will return and keep returning, but in the end, you will bring it under control by plugging away at it. Phil then continued. It was hard for me to believe. It just didn't seem to make sense that an awful head pressure would disappear if I made an effort to spot it. But I can tell you that when I have these symptoms now, all I have to do is to practice Dr. Lowell's rule, and before long they are gone. When Phil set out to practice my rule, why was it hard for him to believe it would work? Why did he feel it made no sense? Nervous symptoms are the result of tensions, and if you spot them as distressing but not dangerous, you dismiss the idea of danger. And without the thought of danger in your brain, you feel safe. And if you feel safe, you relax. And if you relax, you lose your tenseness. And with tenseness gone, the symptoms disappear. What can be more simple? What more easy to believe and more thoroughly in accord with sense? And if this is so, why did my rule appear senseless and unbelievable to Phil? Clearly, Phil thought of nervous symptoms as afflictions which require complex and elaborate means for conquering them. He obviously shared the current view that in order to deal effectively with a nervous complaint, the patient must be subject to a searching investigation for the purposes of unraveling hidden mysteries of thought and tracking down the crafty maneuvers of mischief brewing emotions. If this were true, my rule would be naive, unsophisticated, unbelievable, and decidedly unsuited to the purpose. But it may be that what is really naive and unbelievable is the modern trend to view thought as mysterious and emotion as mischievous. And I shall advise you to reject this contemporary superstition that your thoughts are forever scheming against your welfare and your feelings continually plotting against your health. I shall grant that in our present day setting, leadership is lacking and confusion rampant. And with the amount of confusion governing this world of ours, it is easy to get thoughts muddled and feelings confounded. But recovery refuses to be modern, and the leadership which it supplies aims precisely at teaching you how to conquer confused ideas and perturbed emotions through simplicity of thinking and humility of feeling. I instructed Phil to stop thinking of danger and to command his muscles to relax. His head pressure suggested to him that he was losing his mind. I told him he was not. He will not lose it. Two ideas were presented to him. Of those he chose one. There was nothing to prevent him from choosing the other. Get into your head that a human being has the power to choose what to believe and what not to believe. This power to choose is called the will. The main beliefs between which the will must choose are that in a given condition, you are either secure or insecure. If you accept the thought that your head pressure is the result of a brain tumor, you have formed the belief of insecurity. If instead you choose to think of a mere nervous headache, you have rejected the belief of insecurity and put in its place that of security. Why did Phil think he was unable to swap thoughts? He had been swapping them all his life. For upward of 30 years, he had practiced the game of accepting ideas, rejecting them, and exchanging one for another, dropping them and picking them up just as he wished, wanted, and chose. The swap was usually effected with facility and rapidity. Sometimes it required hard work and a long pull. But whether easy or difficult, the wanting was practiced and the choice was made. What made Phil believe that all of a sudden he had lost the capacity for wanting and choosing? And as to commanding your muscles to do your bidding. This is done every second of your daily activity. You want to sit down, and you do it. You wish to stand and rise from your seat. You decide to make a trip. You enter business. You marry. To save a life or sacrifice your own. And you carry out your decision either instantly or after hesitation and deliberation. Nothing is needed for the successful execution of these acts and plans but will and choice. The thoughts and muscles are made to obey the dictates of the will and choice. Why did Phil assume he could not choose at will to direct his thoughts and to command his muscles? Beliefs are frequently stubborn and obstinate. They may become fixed, offering resistance to the summons of the will. This is particularly the case if the belief has persisted for years. You know how difficult it is for me to shake your belief. You know how difficult it is for me to shake your beliefs that you are doomed, that your heart will give out, that your fatigue will lead to exhaustion. Muscles are just likely to develop obstinacy. They tend to acquire set patterns of behavior, preferring certain well-grooved acts and avoiding others. Just think of the habit of procrastination, of twitches and spasms, of restlessness and sluggishness, and you will realize that muscles are not always pliant tools in the hands of the will. In order to pry loose the resisting beliefs and rebellious muscles, attempt after attempt must be made to dislodge them from their comfortable berth and to force them to give up resistance. The resistance may be so strong that the attempts to break it must be repeated in innumerable trials before success is achieved. This requires the will to use a great deal of power in continued strenuous practice, hence the term willpower and will practice. By exercising its power, the will masters its task and learns how to rearrange beliefs and redirect muscles. Having gone through the learning process, the will gains experience and becomes an expert will. In our days of modern progress, this learning process with its inherent will practice has become largely abandoned. Children are seldom taught to exercise willpower for the mastery of reading and writing. Things are made easy for them. The schools supply all manner of aids to help them avoid exertion. The same holds true for work in the fields of commerce and industry. A person entrusted with a commercial or industrial job is not likely to be subjected to the grinding procedure, learning process, or apprenticeship. Instead, he is broken in by the expedient of accelerated courses in which a number of manipulations are demonstrated to him. This method of giving hurried demonstrations to the senses and facile explanations to the intellect, instead of a thorough training to the will, was permeated most spheres of daily existence. A few flimsy explanatory phrases, and the housewife learns how to use a machine for sewing, cooking, washing, cleaning. A few perfunctory demonstrations teach the buyer of an automobile how to run it. In all of this, modern men and women imbibe the lasting impression that technique has eliminated the necessity for learning. Patient application and practice of will. Most devastating to the learning process and to the exercise of willpower has been the contemporary trend to spoon feed information. In radio forums, newspaper columns, popular magazines, and sundry other vehicles of public education, Brief discussions are offered by obscure persons of doubtful authority in which weighty issues are hurriedly explored and speedily solved by versatile analysis, columnists, and essayists. The learning process is scrapped and replaced by a growing habit of passive listening and easy acceptance. Without the benefit of a will trained to choose beliefs and direct muscles, the men and women of our generation have lost faith in the correctness of their decisions and the relevancy of their plans. They drift along in the shifting current of a rushing existence with little knowledge of how to approach issues and tackle problems. Having neglected or evaded the discipline of the learning process, they lack the know-how of pursuing tasks, of aiming at goals and accomplishing purposes. Faced with difficult situations, they feel helpless. As a result, the modern tendency has been to shy away from responsible pursuits and to entrust their proper execution to experts. These go by the name of specialists, who are supposed to possess the requisite know how for solving problems. The specialist is expected to formulate plans for the rearing of children, to, to make decisions for marriage and divorce, to determine the degree of vocational fitness, to advise in matters of dieting, budgeting, housekeeping, lovemaking, reading selections, and whatnot. With the spread of specialism, self-help and self-management have ceased to play a significant part in the present-day domestic, marital, and social scene. The habit of rushing to the expert for advice has resulted in a vicious cycle of helplessness. The more the expert's aid is solicited, the more helpless the applicant is bound to feel. The greater the helplessness, the more urgent the need for further consultation. The more frequent the consultations, the more poignant the sense of helplessness is. In the end, an individual emerges who has a stunted will, a meager know-how, and a famished sense of resourcefulness. In short, a modern man, the pathetic creature of an extraneous will, without plans or directions of his own, and in abject dependency on forces outside his inner self. I am not a reformer and have no intention to crusade against the modern mania for undisciplined self-expression and a life of senseless speed and meaningless change. My duty is to treat patients, not to cure the ills of the age. But my patients are unfortunately exposed to the detrimental influence of the spirit of the age. That spirit is inimical to the process of learning, to patient striving and persistent willing. If I am to teach my patients to dismiss their settled beliefs of insecurity, if I am to direct them to give orders to their muscles and have them properly executed, if I am to train them to practice self-help and not to depend on the questionable expertise of outsiders, if I am to accomplish all of this, I must first divest their minds of the modern fallacy that being shown a method means learning it, that witnessing a demonstration of skill means acquiring it. With machines, this may be feasible. With life's tasks, it is impossible. My patients will have to realize what former generations always knew, that a life task can be mastered only through a grueling, exacting learning process in which all the resources of the will must combine to achieve final fulfillment. Health is a task of this kind. It can be secured only if the patient's will initiates the system of ceaseless trials and trials and trials until the end of the task is accomplished. If this is done, even the most stubborn belief will yield to the influence of the learning process, and the most sluggish muscles will obey the dictates of the will. Okay, that's the end of that. Next time we start on page 120, The Will to Bear Discomfort. Thank you for joining me. I'll see you again soon.